Hi, my name is Emma Soneson. I'm a postdoc at Oxford, and I'm one of the co-leaders of the Rethinking Education Lessons from Lockdown Special Interest Research Group for Emerging Minds.
Hi, I'm Nikki Chapman. I'm a parent with lived experience and I co-lead the Rethinking Education Lessons from Lockdown SIRG.
Hi, my name's Dave McPartlan. I'm a PhD student in the third year of my PhD looking into mental health in schools. And I'm also the facilitator for the My Mind is My Own Emerging Minds SIRG.
What are you doing at the Big Emerging Minds Summit?
So we are aiming to be the most interdisciplinary group at the whole Big Emerging Minds Summit, in the sense that we want young people, we want parents and carers and their families, we want educators, we want policymakers, we want researchers, we want practitioners. And if you don't fall in any of these categories, we still want you. Because what we want to hear is what makes the dream school for mental health. And one thing that we've learned is that a lot is hidden in averages. There's a lot of complexity that underlies the overall experiences of mental health in schools. And so we want to work together to try to create this dream school. So what would a school that protects mental health, promotes good mental health, responds appropriately to poor mental health, what would that actually look like? And what kinds of steps could we take to move towards that in the real world? So that's what we're really looking to do. It's no small task, but I think with all of those people involved, that we could get a really nice sense of what people are looking for out of the education system.
What's changed about schooling since the pandemic?
In our support groups, I run support groups for parents of children with mental health difficulties. We had for years been hearing of concerns parents were having about children managing school and how difficult that, many of them were finding it. And what particularly seemed to happen was that many of them were just about holding on. Many weren't, and they had already come out of the system in various different ways, like you say, excluded, or parents had felt forced to homeschool because there didn't appear to be another viable option that protected their child's mental health. And during the pandemic, where we were expecting things to get worse and we were trying to put things in place to support families as quickly as possible, we suddenly found actually many families are coming back and saying, we're doing okay, actually. Our children are doing okay. And they're doing okay because they're not having to be in school and they're not dealing with that social anxiety, or if they, have a neurodivergent, condition, then they were managing better without having to manage all the social aspects and different, rules in schools that they found particularly difficult to navigate. And so that seemed to then be replicated across the country from other groups that we spoke to, that young people were finding that, particularly children with anxiety, that they could just focus on their work and they didn't have to worry about everything else. And then consequently, what we saw when schools went back, particularly after the first pandemic lockdown, that those that had been holding on, it's so much worse. If you've experienced then something that's better, a better fit for you, to then try and go back to how it was is almost unbearable. And that's why we saw such a spike in young people being homeschooled, such a spike in non-attendance, and actually, families trying to work out, what do we do now? We know that there's a better way, but there doesn't appear to be a way to. There were so many families that wanted to carry on how things were, but that wasn't offered. And then they were kind of left with, well, what do we do now?
What have you found out so far in your research?
So for our Rethinking Education Lessons from Lockdown Special Interest Research Group, one of the first things that we wanted to do was find out from people what they wanted out of education and what that meant to them. And one of the things I guess we were also really conscious of anecdotally was that various different groups who have, really strong ideas sometimes about what education should look like, often think that other groups think something very different to them. And we had a sense because we were in a privileged position of hearing from all different people, that wasn't actually the case. And so we set out to find out if that was true. And so the first webinar that we ran, we asked people what they wanted the future of education to look like. And we set people into individual groups. So we heard from young people, we had a group of parents, we had a group of educators, we had a group of researchers, we had a group of mental health professionals. And actually, they all went off into separate groups. But when they came back, the messages were pretty much the same, that people wanted mental health to be at the forefront and the center of how education is run as a system. That, they wanted young people to have an opportunity to develop themselves in whatever way that they worked for them, rather than there being a system and you have to tick certain boxes in order to get your qualifications. That they wanted more space, more flexibility in the system for young people to develop who they were and the interests that they had, and particularly interests that are relevant for the type of work and the type of opportunities that are likely to be there for young people going forward, rather than kind of maybe some of the things that are less relevant to young people now.
The way my work panned out was I had older students working and asking questions of younger students about their dream school, if you like. And I think the biggest takeaway I can take from that is that actually the most important bit is that young people are listened to.
What can we do right now to get involved?
So we're encouraging anybody who wants to get involved before the workshop to send us up to 5 ideas of what would make their dream school for good mental health. And you can do this in the form of a bullet point list of art, of music, a video, or a TikTok, really anything you would like. You're very welcome to submit to us as the leaders of this workshop. And all of your submissions will actually be synthesized by young people at the workshop and included in the illustrations that our wonderful illustrator, Leanne, is going to be making after the workshop ends.